Hello and welcome to Nursing Webinar Series. Myself Shanti, and today's topic for the discussion is optimizing sleep for better health. As you all know, with a lot of sleep disorders are on the rise, and it is very essential to learn the science behind healthy sleep. So we are honored to have Dr. Gopikrishna Garu, who is our pulmonologist and senior consultant from Yashoda Hospital, High Tech City. I welcome you, sir. We are honored and privileged to have you with us today.
Good evening, everyone. See, basically, I'm a pulmonologist, and the pulmonologists are the people who deal with sleep and sleep medicine. Of course, the neurologists also see sleep medicine. ENT surgeons pitch in whenever we need some surgical expertise in relation to sleep disorders. So I'm happy to connect with you all. So this is a mode of learning. It's a small phase of learning. I'm not gonna, bombard you with too many medical things and all. I think it should be easy for you to understand what is the, the logic behind sleep and why is sleep required. Okay. So basically, sleep is a state of altered consciousness of our mind. What it does is it relaxes your muscles and it relaxes your nerves. Basically, that is sleep. And next, why is sleep so important? See, a lot of youngsters, they say, sleep is a wastage of time and they spend hours together on the desk or on the laptops or on the mobile phones and they push their sleep back. What is an ideal time to sleep? The ideal time to sleep is from in this new world. It is 10 p.m. to morning 5 or 6 a.m. That's the ideal time. So no, doc, I'm sleeping 8 hours. I'm sleeping from 1 o'clock till morning 9 o'clock. No, still the quality of sleep is not going to help you at all. So WHO, World Health Organization, has picked up sleep. World Health Organization picks up heart diseases, brain diseases, tuberculosis. All these big diseases are being picked up by World Health Organization. Why did it pick up sleep? Because World Health Organization has categorized for any person's general well-being, there are four things. One, good diet, good exercise, good mental health, and last but not least is the sleep. So when we miss this sleep or the consistency of sleep or the quality of sleep, we are going to fall prey for the diseases. You name the disease and it is related to sleep.
So I think that was a very good definition about the sleep. And doctor, like what is sleep deprivation? Like as you said, the quality time of sleep starts from 10 p.m. until the 6 p.m. or 5 a.m. in the morning the next day. And like is this considered as a sleep deprivation? Like not getting poor, not getting adequate sleep or the poor quality of sleep.
Yeah, this is a new problem which we are seeing in a wide spectrum of sleep disorders. We call them as sleep disorders. In the sleep disorders, the new disease which has joined is called sleep deprivation. Sleep deprivation is nothing but you pushing your sleep back or you're restricting your sleep. You means the person, whoever it is. It can be because of illness. It can be because of stress. It can be because of profession, or it can be because of, medicines or drugs, you name it. If we change the sleeping time, the normal sleeping time, or the pattern of sleep, then we are falling prey for sleep deprivation. So what does the sleep deprivation do? So the sleep deprivation slowly starts acting on the brain first, where you'll start losing your concentration. You'll start losing your, compassion or the empathetic things we are supposed to do in medical field. Slowly you'll become rude or slowly you become jittery or angry. These are the first things we see. The next slowly what we see is because of sleep deprivation, you start having gastritis and then follows falling sick, falling frequent colds and coughs, or you name the problem and it is there. So sleep deprivation is a new problem which we have brought into our life. It is because of this blue light. The blue light is your mobile phone, your iPads, or your laptops. Okay, no mobile phone or laptops after 10 p.m. unless and until you're going to take emergency calls.
Yes, I'm very happy that this webinar has been viewed by many of our, Gen Z nurses as well. So yeah, and not even nurses, everybody else. So even I've shared with my family members as well. So they should at least learn out of what has been said to you. Yes. And sir, going forward, how does poor sleep impact pulmonary health,
Yeah.
your lung health? Yes.
Yeah. I would like to say, sleep impacting lung, I would say sleep impacts every organ.
Every
Every
organ.
organ.
Yes. Yes.
The first
Yes.
thing is the mind or your
Yeah.
brain, you can say. The
Yes.
second thing would be the lung, like you said. Third thing,
Yes.
slowly in downhill, in due course of time, it can affect the heart. And
Yes.
it affects, the biggest thing I'm seeing is it affects our immunity.
Yes.
So when the sleep is being deprived or when the sleep is not consistent, then our immunity goes down. So once the immunity goes down, you have all sorts of viral infections creeping in, and we are all 24/7, we are exposed to all different
Yes.
types of bugs, some resistant, some viruses, some bacteria, whatnot. Okay.
Yes.
So you don't want to carry those diseases home. You have to sleep properly. You have to exercise properly. You have to eat properly, and your mental state should be good. So for that, what you need, the first priority, the most important one is your good quality of sleep should be there. Yes, it affects the GI system, causing irritation, nausea, burning sensation. Then the lungs are affected, where you tend to get a little bit of cough and little phlegm, stuffiness of nose. You always tend to have runny nose or blocked nose. In that way, the lungs are also getting affected slowly. When the sleep is being altered.
And I think these symptoms have been experienced, but people tend to bound to just ignore,
Yeah.
and they seek medical attention unless until it is too late. Yes, sir. Going forward, what are the five common symptoms, types of sleep disorder we get to see, sir? Like you heard, I tried mentioning about like insomnia
True.
and sleep apnea. Narcolepsy is again a growing concern, I think, yes. And yes, sometimes we keep hearing like restless, like limbic disorder type and parasomnia. Yes. So are these a person who or a person who experiences all these symptoms should seek medical attention, especially I think narcolepsy. I keep witnessing sometimes this, without any reason or without anything, or maybe after food, they just bound to sleep. So, yeah, what
True.
is your take on this?
Yeah,
Yeah,
the common medical disorders, what we see in our day-to-day, practice as being a pulmonologist, the first one what I see is sleep apnea syndrome. So
yes,
what is sleep apnea syndrome? Sleep apnea syndrome is nothing but the tongue and the uvula. Okay,
yeah,
these are the muscles. When they drop back, when you lie down flat, when they drop back, when they start obstructing your breath, which you are taking by nose and mouth, then which will result in snoring. So after some period of time, what happens is the snoring will continue, and after few minutes, it stops. So that stoppage of snoring is nothing but the choking episode because of this tongue and
mm,
uvula falling back and giving rise to an apnea. Apnea is nothing but stoppage of breath, a
stoppage of
cessation
breath.
of breath. So
Yes,
what happens in these patients? They choke, they desaturate, they wake up.
yes,
The brain wakes
yes,
them up. So because of this, what happens is their quality of sleep. See, broadly, sleep has four stages. Stage
yeah,
one, stage two, stage three, stage four. One and two are light sleep. Three and four are deep sleep. So stage one and stage two should be like 50%. Stage three and stage four should be 50% in our sleep. That is one cycle. So what happens is we should get 2-3 cycles like that in one night of sleep. So as soon as the patient dozes off and he chokes, he wakes up. So from stage one to he has to jump to stage two to stage three, stage three to stage four. So as soon as he chokes in stage two, he'll be awakened. So again, 1, 2, 3, choke, awaken. So 1, 2, choke, again awake. So
yes,
his light sleep will increase, his deep sleep is gone. Deep sleep is like a chase dog. It doesn't leave you. So what happens in these patients is in the daytime, when they are, not active, when they are dull,
yes.
they are sitting, isolated, then they tend to doze off.
They
This is
tend to
sleep
close. Yeah.
apnea. Okay, this we see in a lot of patients. These people present with uncontrolled hypertension, uncontrolled diabetes, and you can see lots of patients in the OPD corridors or the patients' waiting rooms where people tend to, sit and sleep in the
Those on,
chairs.
yeah,
Okay,
yeah,
can be
yes,
because of deprivation, can be because of sleep apnea too.
yes,
The other
yes,
thing, insomnia, we see in patients who are a little, what you call anxious, or
yeah,
people who have genetically, some people, they don't get proper sleep. There are light
yes,
sleepers too. So in
yes,
those people, we have something called insomnia, is not falling good, not getting good sleep. The other thing, like you said, madam, like narcolepsy is commonly, seen nowadays. Slowly it is rising. Okay. It's something like, you tend to, not move in your sleep, or you tend to get fixed up. Okay. And you
yes,
tend to, suddenly fall asleep, or,
yes,
these things do happen. Restless leg syndrome is nothing but a part of your sleep apnea, where the patient would be continuously moving his fingers or arms. Sometimes people kick in the sleep. The bed partner
yes,
complains, my husband is kicking me, or slapping me, and he
exactly.
tends to act
Huh.
as if he's sleeping. So these things we see. This is all because of these, the syndrome, the restless leg syndrome. So what happens in these patients is, because of continuous movements and all, the muscles are acting there. So as soon as
Mm.
they wake up in the daytime, they tend to complain, my legs are aching, my hands are aching, my neck is aching. So all these things are because of continuous mobility of those muscles and the nerves. So that cannot be ignored. So it can be one of the feature. Okay. Parasomnias are all, different senses of sleep, sleep
Yeah,
talking, sleep biting, teeth grinding. We call it as bruxism, where people make noises.
yes,
So
sexism,
these
yeah.
are all different types of sleep disorders, what we see.
And I think it is connected to the myth that, sometime when they, grind their teeth or abnormally
Yeah.
moves, they say one must have watched the horror movie and they are just screaming,
Yeah.
walking, all that. Yes, sir, I
True.
think. Yes,
Exactly.
yeah. Very great input you have provided to
Yeah.
us. Yes, sir. And yeah. So going forward, how is sleep deprivation diagnosed, sir? I think we do sleep study, nothing but polysomnography, and these are
Yeah.
the little enlisted criteria I have,
Hmm.
put down. So what is your take on this, same, sir?
Yeah. It's not about sleep deprivation. I would like to broadly put as sleep disorders. Okay.
Sleep disorder.
So
Yes,
most
yes,
of the sleep disorders, they are diagnosed by doing something called polysomnography, or in a
yes.
crude way, we can say sleep study.
Sleep
Okay.
study.
So
Yeah,
sleep study is nothing but, a patient during his sleep. What we do is we measure their brain waves to see whether he's getting a good quality of sleep or not,
yeah,
whether he is into stage one, two, three, four or not. Second, we check the eye movements. Third,
yes,
we see the snoring sensor.
yes,
Okay. And fifth, we see if there is any movement of the muscles of the face. And sixth, we see the chest movements. We tie a band. And we all know the pulse oximeter, the fingertip pulse
yes,
oximeter, all these things, including the hands and movements of the hands, and the ECG, EEG, EOG, all these things together would be recorded overnight. For 10 seconds of ECG, they give a big paper, right? So
yes.
it's the sleep studies with all these things all
Huge.
through the night, it will
Yes,
fill the room up. Such a big study it is. So what we tend to do is we record it, and there is something called sleep technologists. Okay, they
yes,
tend to pick up the abnormal things in that sleep
yes,
study, and those things are presented to us. So then we start diagnosing whether he has a sleep apnea, or he has a parasomnia, does he have a restless leg syndrome, like that we diagnose. So
yes.
that is called as a sleep study. Very
Sleep
simple
study.
study, non-invasive study, overnight study.
Yes,
Yeah.
very simple technology. Yes, yeah. And yeah, yes, you have already explained about the stages of sleep. And as per you, I think, sir, the stages of sleep and the pattern of sleep without any abnormal muscle movement, one should sleep bed-bound, relaxed. Then only it is considered as a normal sleep pattern, or, in different stages, as per the pattern of sleep,
Yeah,
they interact differently, I
I
think.
understand. See,
Yes.
in this sleep stages, it's so interesting in sleep, understanding
Yes,
the
sir.
physiology of sleep. Like I said, stage one, two, three, four, right? So stage
Yes.
one is closing your eyes. Two people are sitting in your room. The window is open. You'll know that much. That is stage
Yes.
one. The stage two of sleep is you dozed off, loud sounds, banging of the door,
Yes.
or some mobile phone ringing. These things you will be knowing. Stage three, knocked off. You'll
Yes.
not know anything. Your muscles, your body, your nerves, everything is relaxed.
No
Stage
wakefulness.
four and three, the difference is stage three with dreams is stage four. Yeah. Now, a lot of
Yes.
people ask, why do we get bad dreams? Why do we get good dreams? There is
Yes.
no reason particularly till now. Only, the scientists could identify only the kids get dreams of animals, especially elephants. Okay. So they could decipher that much only. Okay.
Yes.
So sleeping like a baby, they say, like, when you toss around, they turn, right?
Yes.
So
Yes.
that is, it happens in stage three and stage four. That's the reason they are called non-REM sleep and REM sleep. REM is the stage four. REM means the movement of the eye.
I
The eye
repeat.
would be
Yeah.
moving, in a synchronous manner. That is called
Yes.
REM. It is at stage four.
Yes.
So we have diseases in relation to three, four sleep too, but it's too much of a, entering into sleep medicine.
Yes.
This is
Yes.
how we categorize and we try to look at, sleep stages and all.
And going forward, as you were discussing about sleep apnea, I think not, sleep problems like, yes, for sleep apnea, I think CPAP is the best
Yeah.
option. But
Hmm.
for other sleep disorders also, I don't think that CPAP is the options, or it depends on your,
Uh,
evaluation. Yes.
Especially for sleep apnea syndrome, we tend to use non-invasive ventilations. That is the
Yes.
CPAP, continuous positive airway pressure. What it does, it's just like your vacuum cleaner. You have a box, you have a hose pipe, you have a nozzle. Vacuum cleaner, what it does, it just sucks in the air. In
Toxin. Yes. Yes.
CPAP, it just blows the air. Here also you have a box, you have a hose pipe and a mask.
Yes.
So here there are some sensors which will detect, whenever you tend to choke, it opens up the throat. So in
Okay.
that way, we use things called CPAP or a BiPAP, depending on the patient's condition, the severity and the type of sleep disorder we tend to use, especially in patients with sleep apnea syndrome. Yeah, in restless leg syndrome, we tend to identify if there are any mineral deficiencies like iron deficiency, calcium, or ferritin deficiency like that, and then we tend to correct. In
Yes.
insomnia, usually we use medications. Okay. In jet lag, we tend to give some time so that that settles up. Sleep deprivation needs training. Sleep deprivation needs counseling. Sleep
Toxin.
deprivation needs, we need to understand to say no for the gadget.
Yes.
That's the
Yes.
most important. Still, sometimes because of this professional work, doing night duties, night shifts, abnormal shifts, so people tend to get those sleep disorders. They might need medications along with cognitive behavioral therapy, we say CBT,
CBT.
which
Yes.
might be
Yes.
needed.
Yes. So, yes, as you said, are weight loss, breathing support, and surgery commonly recommended strategies as case to case?
Yeah, it is based on person to person, the
Yes.
age of the patient, how severe he is his disease, and whether he is compliant with his CPAP or not.
Yes.
Based on that, we take these decisions. Okay. So commonly what we surgeries we advise is only in younger patients, where what we do is something called uvulopalato-pharyngoplasty.
Yes.
Means
Yes.
we tend to remove the uvula and the muscles around the uvula and tend to reduce the thickness of the tongue. This is all not by cutting. The cutting surgery is only for uvula and the muscles. For the tongue, we use something called RF ablation, radio frequency ablation. So
Ablation.
there is, the thickness of the tongue would be reduced. This is the sleep surgery we say for sleep apnea. The indirect way of doing a sleep surgery is going for a bariatric surgery. If the patient is obese,
Yes.
they tend to have sleep apnea. So
Yes.
once their bariatric surgery is done and then tend to lose weight, then sleep apnea just goes away. So in that way, we tend to advise some surgeries in sleep disorders too. They do help in some patients.
And so, nowadays, we are just, we see people taking a lot of melatonin,
Yeah.
and they consider it as a magic pill, and especially taken for chronic insomnia, like, and a few jet
Mm.
lags and all. And it is, I think, myth or benefit or fact, we don't know, but that is how we want to have your opinion on the
Yeah.
same. And is this I think this is a OTC drug, and no, or it should be, taken with prescription. Your take on the same.
Yeah. I suggest melatonin should be advised by the physician or a
Yeah.
pulmonologist or a
Yeah.
neurologist rather
Yes.
than buying over the counter.
Yes.
It's just a hormone which is there in our body. Okay. So is the hormone reduced like a thyroid? Why should we buy that hormone and take the pill? Okay.
Yes.
So in what way does melatonin help? Why the doctors prescribe? See, doctors prescribe melatonin in a very, very low dose in people who are being sleep deprived, who change their sleeping patterns. That is
Yes.
only the melatonin is given an extra supplement to bring it back. Your sleep use being
Yes.
pushed back would be brought back. That is not only with the pill. So I would say it is more of a myth that it's a magic pill. It doesn't do anything. You
Yes.
think like taking a melatonin is going to give you a good sleep? No, not at all.
Yeah.
So melatonin definitely helps, but it is only for people who are shift work disorder, people who have those disorders, or people who have, sleep deprived and all to, bring them back to their routine. Then it sometimes helps.
And I think it is very important that they should not develop dependency by
True.
taking melatonin without
Yeah.
prescription. Yeah. Yeah, you have already said. And so is this is the common condition because of this many people are partners in the family,
Mhm.
everybody's
True.
distant. I think, yeah, is loud snoring a serious
See,
problem?
yeah, sorry. So loud snoring. A lot of people think snoring is because is coming from the nose. Common people think it is from the nose. Absolutely not. So
No.
snoring is purely from the throat, okay, from the
Yes.
pharynx,
Yes.
because of the uvula and the tongue. Can be both or one of the
Yes.
thing dropping back and causing obstruction to our breath when we take a breath
Yes.
by the nose or by mouth. Then once it starts obstructing, then the snoring is being produced. So any person who has a snoring, first thing, observe his pattern of snoring. Is there a pause in his snoring? If there is a pause in the snoring, it has to be checked. There is no pause in the snoring and he's continuously snoring,
Continuous.
then
Yeah.
it doesn't cause any problem to him as per se for the person, but definitely for the bed partner would be really tough.
Yes.
Yeah.
Yes. Yeah. And yeah, and we are just, coming to the end of the discussion. And what are the key habits for getting good sleep, as you have mentioned, and we try to figure out
Yeah.
few. Yes.
Uh, See,
Yeah.
I'll tell one thing. A very old quote is there from Shakespeare. He
Yeah.
used to say, sleep is nothing but balm of hurt minds and chief nourishers in life's feast. Okay. What it
Yes.
does is it helps you, you know, getting better from your day-to-day insult, the sleep.
Yes. Yes.
We have stressed our mind, our body
Mm.
so much all through the day. Getting that 6 hours of sleep is curing our problem. Or it is
Restored. Yes.
replenishing your body
Yes.
so that you will
Yeah.
be active and energetic for the next day or next
Yes.
day's insult, you can say. Okay.
Yes.
Yeah. So
Yes.
in that, there are something called, we call them as sleep hygiene. Okay.
Sleep
In sleep,
hygiene. Yeah.
yeah, in sleep hygiene, we tell the patient or the person to, fix a time of sleep. Whether he gets a sleep or not, he has to go to bed by 10 o'clock. Okay. And he has to wake up by 5:30 or 6, or as long as he can sleep. Minimum 7 to 9 hours is required. Okay. Minimum 7, max of 9. That is sufficient. Second, the bedroom should be dark. No bed
Yes.
lights, no, hoardings beside our house, no loud, like temples or mosques or,
Mm.
any loud thing should not be there near our bedroom. That should be
Noise.
taken
Yeah.
care. Third, no television in the bedroom. Absolutely no television.
Mm.
Okay. Fourth, so when we are trying to sleep, the temperature should be optimum, like, maintaining the, air conditioning or the fan should be proper. Fifth, you need to eat your dinner by 7 or 7:30, not after 8:30 or 9. When you take a late dinner, your sleep is also changed. The pattern of
Mm.
sleep is changed.
Very
A lot of
important.
people, after having dinner, they go for a walk. Absolutely wrong. Okay. So, yes, when you have
Oh my
dinner,
God.
the
Yeah.
blood is completely concentrating to give you a digestion and comes to your GI system. You start walking, it goes to the muscles. You tend to develop that, gastric irritation, or these things will be there.
Or flexes or
Yes. So in sleep hygiene, we say the exercise should be 2 hours prior to your sleep, not after that. So you want to
yeah.
sleep by 10 o'clock, whatever exercise you do before 8 o'clock. Okay.
So if you have taken your dinner at 7 p.m., then
Hmm.
soon after dinner, you can just go for the walk, and then
Usually
with a gap of
we
2 hours, you can go to bed. Is it
yeah,
so?
see, I'm saying you want to have dinner by 7:30, you do your exercise by 6:30 and close it off.
Oh, okay.
Got it?
I'm sorry,
So
I'm
not after
mistaken.
that.
Yes. Yeah,
Okay.
yeah, yeah,
So that these are some small things where we say, and no mobile phones unless you get
yeah.
emergency calls like us. Okay. So or else this is basic thing we suggest for sleep hygiene.
So yeah, this is our last slide, and after that we end the session. And your conclusion
Yeah.
on the same, like, can this disorders or the pattern of sleep or sleep problems be prevented? Your
Yeah.
take on the same, and I think rising concern about the alcohol and smoking, like few they always experience, and they say alcohol induces, or when they consume alcohol and they bound to sleep better. So this myth, or this is a fact, this your
Both are
suggestion
there.
is
See,
both
alcohol
are there.
induces sleep for a short period. As soon as you take alcohol, you tend to have a good sleep when it is taken in moderate quantities. And then what happens is after that, if the person has a little, the thick tongue or the uvula, they tend to become weak and they fall back and he starts snoring. You can see a lot of people after taking alcohol, they snore really loud.
It
Even
does,
people
yeah.
who don't snore regularly also they snore. So this snoring can cause pauses in their, breath during the sleep and cause disturbance in the sleep.
Yes,
So it is a myth too that, alcohol will induce sleep and all. No. And alcohol is based on, the quantity. So yeah, for first month, you might take 30 ml and you might fall asleep. But from second month and third month, 30 ml will not be sufficient. So how long you want to increase the dose? You can't.
yes,
So definitely it's a myth more than, the fact
yeah.
that alcohol will cause sleep. And I'll say smoking, yes, disturbs sleep. It activates the brain. Third, too much of coffee and too much of tea is going to cause problem. Yeah.
Thank you, sir. That was very interesting, though it was the time was not sufficient. And thank you so much.
Thank you.
And I urge all the viewers to just log in www.yashodahospitals.com for more update, as our doctors, our clinical expertise, and us, we try to create a lot of learning platforms for all the viewers. And thank you, sir. That was a very amazing session. Thank you so much.
Thank you.
We end the session.